Slide 1. Introduction: Ensuring Healthy Lives and Well-Being for All. Continuing from my last week presentation, your host Dr. Harshit Simha once again discussing the Sustainable Development Goal 3, SDG 3, which is a universal commitment to achieving health equity and promoting well-being for people of all ages. It firmly establishes health as a fundamental human right and a critical cornerstone of sustainable development itself. Adopted by all United Nations member states in 2015, this ambitious goal aims to address persistent global health inequalities, from maternal mortality to infectious diseases, while simultaneously confronting emerging threats like non-communicable diseases and pandemic preparedness. Its scope is comprehensive, targeting improvements in everything from sanitation and road safety to universal health coverage, UHC. The significance of SDG 3 lies in its interconnectedness. Health is both an outcome and a driver of progress in other SDGs, such as poverty reduction, SDG 1, quality education, SDG 4, and clean water and sanitation, SDG 6. However, significant challenges remain, particularly in strengthening health systems, ensuring equitable access to care, and closing the financial protection gap. The COVID-19 pandemic underscored these vulnerabilities but also renewed global focus on building resilient health infrastructure. Achieving SDG 3 requires sustained political will, increased investment, and collaborative action across all sectors and nations. Slide 2. Understanding SDG 3, Core Targets and Indicators. Sustainable Development Goal 3, SDG 3, is a comprehensive framework for global health, defined by 13 specific targets and their accompanying indicators. These targets provide a measurable roadmap for achieving health and well-being for all. The core areas of focus, as highlighted, include achieving universal health coverage, UHC, to ensure access to quality essential healthcare services without financial hardship. This is a foundational target that enables progress in others. Significant emphasis is also placed on improving maternal and child health by drastically reducing preventable mortality rates. Furthermore, SDG 3 tackles both ancient and modern threats by aiming to end epidemics of communicable diseases like AIDS and malaria, while also addressing the growing burden of non-communicable diseases, NCDs, such as heart disease and diabetes through prevention and treatment. Each target is tracked by precise indicators that measure outcomes, such as maternal mortality ratios, vaccination coverage rates, and premature mortality from NCDs. These indicators are vital for assessing progress, identifying disparities, and holding governments and the international community accountable. Recent data shows that while progress has been made in some areas, the world is off track to meet most health-related targets by 2030, necessitating urgent and renewed commitment. Slide 3. The global significance of SDG. The significance of Sustainable Development Goal 3, SDG 3, extends far beyond the health sector. It is a fundamental pillar of global stability, economic prosperity, and sustainable development. The stark statistics underscore its urgency. 400 million people lack essential health services, over 800 women die daily from preventable pregnancy complications, and 5.2 million children die annually before their 5th birthday. SDG 3 is critically important because health is both a precondition for and an outcome of development. A healthy population is a productive one, enabling children to learn, adults to work, and economies to thrive. Conversely, poor health cripples societies, perpetuates poverty, and places enormous strain on social systems. The estimated $1 trillion United States dollars in economic losses in low-income countries due to poor health highlights this devastating drain on resources. Investing in health yields exponential returns across all dimensions of sustainable development. Progress on SDG 3 directly accelerates achievements in poverty reduction, SDG 1, quality education, SDG 4, and decent work, SDG 8. Therefore, achieving the targets of SDG 3 is not merely a health objective but a strategic investment in a more resilient, equitable, and prosperous global future. Slide 4. Health as a human right and development indicator with social determinant. Sustainable Development Goal 3, SDG 3, is fundamentally rooted in the principle that health is a basic human right, as recognized by international conventions like the WHO Constitution and the Universal Declaration of Human Rights. This rights-based approach mandates that access to quality healthcare must not be determined by socioeconomic status, geography, or other discriminatory factors. Viewing health through this lens transforms it from a charitable goal into an entitlement, obligating governments to build equitable health systems for all. Beyond its ethical imperative, health is a powerful driver of economic development and a key indicator of a nation's overall progress. Healthy populations are more productive, innovate more readily, and contribute more effectively to economic growth. The World Bank estimates that a 10% improvement in life expectancy can boost annual economic growth by 0.4%. Conversely, poor health places a massive strain on economies. Households facing catastrophic health expenditures are often pushed into poverty, creating a vicious cycle that stifles development. Furthermore, health is a critical factor for social stability. Robust public health systems build societal resilience, foster social cohesion, and protect communities from the devastating impacts of health crises, as starkly demonstrated by the COVID-19 pandemic. However, achieving health equity requires looking beyond clinics and hospitals to address the social determinants of health, SDH, the conditions in which people are born, grow, live, work, and age. These non-medical factors are primary predictors of health outcomes. Economic factors, income and employment stability dictate access to nutritious food, safe housing, and quality healthcare. In India, a 10% increase in household income is shown to reduce the risk of catastrophic health expenditure by 15%, directly linking economic security to health security. Environmental conditions, air pollution, contaminated water, and inadequate sanitation are major causes of mortality. In India, air pollution is responsible for an estimated 1.67 million annual deaths, while poor water and sanitation contribute to nearly 500,000 diarrheal deaths annually, highlighting the inextricable link between a clean environment and public health. Education and awareness. Education, particularly for women, is a powerful health intervention. Each additional year of maternal education reduces child mortality by 5 to 10% through improved health knowledge, better nutrition practices, and enhanced decision-making autonomy. Social inclusion and equity. Deep-seated social stratifications based on gender, caste, and ethnicity create profound health disparities. In India, scheduled tribe populations experience healthcare utilization rates 14% lower than general categories, a clear indicator that discrimination remains a significant barrier to health access. Therefore, achieving SDG 3 requires a dual approach, strengthening health systems to uphold the right to health while implementing cross-sectoral policies that address these root causes of health inequality. Investing in poverty reduction, clean air, quality education, and social justice is, fundamentally, an investment in health. Slide 5. India's health landscape, progress and challenges. India's health sector has witnessed remarkable transitions in recent years, marked by both notable achievements and persistent systemic hurdles. One of the significant areas of progress is in maternal and child health, with infant mortality reduced by 42% since 2000. However, maternal mortality remains high, at 113 per 100,000 live births, highlighting continued challenges in ensuring quality maternal care. Healthcare infrastructure in India exhibits stark rural-urban disparities. Approximately 70% of the country's healthcare infrastructure is concentrated in urban areas, which serve only 30% of the population. This leaves rural regions underserved, with limited access to advanced medical services and personnel. Meanwhile, India faces a double burden of disease. Persistent communicable diseases like tuberculosis, TB, and malaria coexist with rising non-communicable diseases such as diabetes and cardiovascular disease. This epidemiological imbalance strains India's public health resources and calls for integrated disease management strategies. As regards healthcare financing, India's low public health expenditure, just 1.28% of GDP, is compounded by high out-of-pocket costs, which represent 63% of total health expenditure, posing a financial burden on families and leading to healthcare inequity. Nonetheless, advances in health technology are transforming care delivery. The fast-growing mHealth market, expanding at 31% annually, enables remote monitoring, appointment scheduling, and health education via smartphone apps like mDiabetes and Cohesion, which have reached millions of users. Telemedicine platforms, especially Sanjeevani, have enabled over 90 million virtual consultations, facilitating doctor-patient interactions across distance barriers, which proved indispensable during the COVID-19 pandemic and for remote populations. India's health information systems such as the Electronic Vaccine Intelligence Network, EVAN, have greatly improved logistics, reducing vaccine stockouts and wastage. Furthermore, AI-driven diagnostics have enhanced screening and treatment. For example, tools like NIRAM-AI are 27% more accurate than traditional breast cancer screening, while being less invasive and more affordable. Despite these technological strides, equitable distribution, sustainable financing, and an integrated approach to disease burden remain critical for advancing health outcomes in India. Slide 6. India's flagship health initiatives. India has launched several ambitious flagship health initiatives to accelerate progress toward universal health coverage, UHC, and achieve the targets of SDG 3. These programs represent a multifaceted approach to addressing the nation's complex health challenges. The cornerstone is Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, PMJAY, the world's largest health insurance scheme. It provides an annual coverage of 5 lakh rupees per family to over 500 million vulnerable Indians, directly protecting them from catastrophic health expenditures that cause poverty. To strengthen preventive care, Mission Indradhanush aims to achieve full immunization coverage for children and pregnant women against 12 vaccine-preventable diseases, targeting those missed by routine services. Leveraging technology, the National Digital Health Mission, NDHM, creates a unified digital health ecosystem. By providing citizens with unique health IDs and digitizing health records, it aims to improve the efficiency and portability of healthcare services across the country. Complementing these efforts is Poshan Abhiyan, National Nutrition Mission, which tackles the critical challenge of malnutrition through a focused strategy on the first 1,000 days of a child's life, using community mobilization and technology. Together, these initiatives demonstrate a comprehensive strategy, moving beyond treatment to encompass financial protection, preventive care, digital innovation, and holistic well-being. Slide 7. Urban-rural health divide in India. India faces a profound and persistent urban-rural health divide, creating significant inequalities in healthcare access and outcomes. This gap is a major obstacle to achieving universal health coverage and the targets of SDG 3. The urban health scenario is characterized by concentrated resources. Approximately 70% of India's hospitals and 80% of its doctors are located in urban areas, which house less than 35% of the population. Major cities boast a high density of specialists, advanced diagnostic facilities, and greater penetration of health insurance and corporate healthcare options. In stark contrast, rural India, home to over 65% of the population, faces severe challenges. There are over 10,000 vacant doctor positions in rural primary health centers. This results in a critical shortage, with one doctor serving over 2,000 people in remote regions, compared to 1:500 in cities. Rural health facilities often lack reliable electricity, clean water, and essential medicines, leading to a higher dependence on unqualified practitioners. This disparity translates into worse health outcomes for rural citizens, including higher maternal and infant mortality rates, lower life expectancy, and a greater likelihood of being pushed into poverty by catastrophic health expenditures. Bridging this chasm requires targeted policy interventions, increased investment in rural health infrastructure, and innovative solutions like telemedicine to ensure equitable health for all. Slide 8. Communicable diseases in India. Persistent challenges. Despite significant progress, communicable diseases remain a formidable public health challenge in India, threatening lives and impeding socio-economic development. The country continues to bear a disproportionate burden of several major infectious diseases. India accounts for a staggering 27% of the global tuberculosis (TB) burden, with an estimated 2.64 million new cases annually. The emergence of drug-resistant strains complicates elimination efforts, despite the ambitious target to end TB by 2025. Waterborne diseases, primarily linked to inadequate sanitation and clean water, are a leading cause of mortality, claiming over 100,000 children's lives each year from diarrheal illnesses alone, with cases spiking seasonally during monsoons. Furthermore, vector-borne diseases like dengue, 100,000 plus annual cases, and malaria, approximately 1 million cases yearly, cause widespread seasonal epidemics. Climate change is exacerbating this threat by expanding the geographic spread of disease vectors. While the National AIDS Control Program has made strides, HIV/AIDS persists as a concern with 2.14 million people living with HIV and approximately 69,000 new infections each year, particularly among key populations. These persistent challenges highlight the critical need for sustained investment in robust public health infrastructure, improved sanitation, enhanced disease surveillance, and targeted interventions to achieve India's health-related sustainable development goals. Slide 9. The rising burden of non-communicable diseases in India and status of mental health. India is in the midst of a profound epidemiological transition, where non-communicable diseases, NCDs, have become the nation's leading cause of mortality, accounting for nearly 65% of all deaths. This surge is propelled by rapid urbanization, sedentary lifestyles, dietary shifts towards processed foods, and an aging population. The four major NCDs, cardiovascular diseases, cancers, chronic respiratory diseases, and diabetes, pose a severe threat to both public health and economic stability. The economic impact is staggering. The World Economic Forum estimates that India stands to lose a cumulative $4.58 trillion between 2012 and 2030 due to NCDs and mental health conditions, representing a massive drain on productivity and healthcare resources. Compounding this NCD crisis is India's severe and often overlooked mental health epidemic. An estimated 197 million Indians live with mental disorders, ranging from depression and anxiety to substance use disorders. Despite the scale of this crisis, it remains deeply stigmatized and critically underfunded. A massive treatment gap of 83% means the vast majority of those affected receive no professional help whatsoever. This gap is fueled by an acute shortage of mental health professionals, with only 0.3 psychiatrists per 100,000 people, far below the global average, and a paltry allocation of less than 2% of the national health budget to mental health. The landmark Mental Healthcare Act of 2017 was a revolutionary step, legally recognizing the right to mental health care and decriminalizing suicide. The major scale of challenges is 197 million Indians with mental disorders. However, its implementation on the ground has been slow and uneven, hampered by infrastructural gaps and a lack of trained manpower. The coexistence of NCDs and mental health disorders is particularly concerning, as they often form a vicious cycle. Chronic physical illnesses can trigger mental health issues, and vice versa. Addressing this dual burden requires a paradigm shift in India's health policy. It necessitates a stronger focus on preventive healthcare, screening, and health promotion to curb NCDs. Simultaneously, closing the mental health gap demands massive investment in building community-based care models, integrating mental health into primary healthcare, and destigmatizing mental illness to ensure that the right to health encompasses the mind as much as the body. Slide 10. Healthcare financing, India's critical challenge. India faces a critical challenge in healthcare financing, with its public health expenditure stagnating at a low 1.28% of GDP. This figure falls drastically below the World Health Organization's recommended benchmark of 5% and is among the lowest globally, especially when compared to other major economies. This chronic underinvestment in public health systems has a direct and devastating consequence: a heavy reliance on out-of-pocket expenditure, OOPE. Currently, 63% of total health expenses in India are paid directly by patients at the point of care. This model is financially catastrophic for millions, pushing an estimated 55 million Indians into poverty each year when they are forced to choose between paying for medical treatment and other essential needs like food and education. This high OOPE creates a significant barrier to accessing healthcare, disproportionately affects the poor, and undermines the goal of universal health coverage, UHC. Addressing this financing gap through increased public spending is essential to strengthen health infrastructure, expand insurance coverage like Ayushman Bharat, and ultimately protect citizens from financial hardship, making healthcare a right, not a privilege. Slide 11. Global health disparities, a comparative view. The state of global health is marked by profound and persistent disparities, as illustrated by key indicators such as life expectancy, infant and maternal mortality, and the density of healthcare providers. These metrics reveal a stark divide between high-income countries and the rest of the world, underscoring the immense challenge in achieving SDG 3's promise of health for all. High-income nations enjoy significantly better health outcomes, with a life expectancy of 80.8 years, an infant mortality rate of just 4.6 per 1,000 live births, and a low maternal mortality ratio of 11 per 100,000 births. This is supported by a robust health workforce, with 28.7 physicians per 10,000 people. In stark contrast, sub-Saharan Africa faces the most severe challenges, with a life expectancy of 61.5 years, an infant mortality rate of 52.7, and a devastatingly high maternal mortality ratio of 542. This region also suffers from a critical shortage of health workers, with only 2.3 physicians per 10,000 people. India, positioned in the middle of this spectrum, reflects both progress and ongoing challenges. While its indicators are better than the sub-Saharan African average, they lag far behind high-income nations. An infant mortality rate of 28.3 and a maternal mortality ratio of 113 highlight significant gaps in access to quality maternal and child healthcare services. These disparities are not inevitable, they are the result of inequalities in healthcare access, funding, infrastructure, and the underlying social determinants of health, such as poverty, education, and sanitation. Closing this gap requires targeted global interventions, increased investment in health systems, and a renewed commitment to equity to ensure that geography does not determine one's right to health and survival. Slide 12. COVID-19, exposing health system vulnerabilities. The COVID-19 pandemic starkly exposed the vulnerabilities in health systems worldwide, including India. In the early phase, January to March 2020, initial containment measures such as international travel restrictions and surveillance systems were implemented. However, the health infrastructure was unprepared for the impending crisis, revealing gaps in testing, resource allocation, and healthcare capacity. The first wave, April to November 2020, marked a nationwide lockdown as the government sought to control the spread. During this period, health infrastructure was expanded, but the case numbers remained relatively controlled, reflecting the initial success of containment efforts. Nonetheless, the system faced challenges in ramping up testing and managing the surge in cases. The second wave, March to June 2021, was catastrophic, characterized by an overwhelming surge of cases exceeding 400,000 daily infections. Hospitals faced oxygen shortages, overwhelmed capacity, and insufficient medical supplies, exposing critical gaps in infrastructure, supply chains, and preparedness. This wave underscored the fragility of India's health system under extreme stress, with many hospitals struggling to cope with the rapid escalation. In response, India launched its largest vaccination drive, 2021-22. Over 2 billion doses were administered, aiming to build immunity and curb the virus's spread. While the vaccination campaign was a significant achievement, logistical challenges, vaccine hesitancy, and disparities in access persisted, especially in rural and underserved areas. Overall, COVID-19 revealed systemic weaknesses such as inadequate infrastructure, fragmented data systems, and supply chain vulnerabilities. The pandemic underscored the urgent need for resilient health systems that can withstand future crises, emphasizing the importance of strategic planning, investment, and inclusive health policies to ensure preparedness and equitable healthcare access. Slide 13. Success Stories, Global Health Achievements. Amidst significant health challenges, several remarkable success stories demonstrate the power of coordinated global action, political will, and innovation in achieving public health milestones. These achievements offer a blueprint and hope for addressing other health priorities. A landmark victory is the near eradication of polio. Since the launch of the Global Polio Eradication Initiative in 1988, wild poliovirus cases have declined by 99.9%. India's certification as polio-free in 2014 stands as a testament to what can be accomplished through relentless vaccination campaigns and community engagement, even in the most complex and populous settings. The global response to HIV/AIDS represents another extraordinary turnaround. The scale-up of antiretroviral therapy, ART, has transformed HIV from a fatal disease into a manageable chronic condition. Between 2010 and 2022, AIDS-related deaths decreased by 39% globally. Countries like Thailand and Brazil have shown that through political commitment and public health programs, equitable access to prevention and treatment can be achieved, saving millions of lives. Furthermore, progress in maternal health proves that targeted interventions work. The global maternal mortality ratio, MMR, declined by 34% since 2000. Rwanda's achievement is particularly inspiring, reducing its MMR by 80% through a multifaceted strategy involving a robust network of community health workers, performance-based financing, and a commitment to universal health coverage. These successes underscore that with strategic investment and strong governance, dramatic improvements in health outcomes are attainable. Slide 14. Traditional medicine, integrating ancient wisdom with modern healthcare. The global resurgence of interest in traditional medicine represents a paradigm shift towards holistic, culturally resonant, and often more accessible healthcare. Systems like Ayurveda, India's 5,000-year-old science of life, yoga and meditation, Unani medicine, and traditional Chinese medicine offer time-tested approaches focusing on balance, prevention, and the interconnection of mind, body, and spirit. Recognizing this value, India has institutionally promoted these practices through the Ministry of Ayush, Ayurveda, Yoga and Naturopathy, Unani, Siddha, and Homeopathy, aiming to validate and integrate them scientifically into the national health framework. A landmark global initiative is the establishment of the WHO Global Centre for Traditional Medicine, GCTM, in Jamnagar, Gujarat. This center is pivotal for fostering evidence-based research, setting standards, and creating a repository of traditional knowledge. This integration is not about replacing modern medicine but creating a synergistic integrative health model in India. It can potentially address critical challenges of accessibility and affordability, especially in rural and underserved communities where traditional practitioners are often the first point of contact. Furthermore, it empowers individuals by providing diverse options for managing chronic conditions and promoting overall wellness, all while preserving invaluable cultural heritage. The future of global health lies in a pluralistic system that harnesses the best of both ancient wisdom and modern scientific innovation. Slide 15. The path forward. Health as a foundation for sustainable development. Achieving Sustainable Development Goal 3, ensuring healthy lives and well-being for all, is not an isolated pursuit but the very bedrock upon which sustainable development is built. The path forward requires a fundamental shift in perspective, recognizing health as both a critical outcome and a powerful driver of economic prosperity, social stability, and environmental resilience. This necessitates moving beyond incremental changes to transformative, system-wide strategies. The cornerstone of this transformation is achieving universal health coverage, UHC, which guarantees all people quality health services without suffering financial hardship. This requires innovative financing mechanisms to increase public health expenditure, ideally to a minimum of 2.5% of GDP, to reduce the current reliance on catastrophic out-of-pocket payments. UHC must be underpinned by a strengthened primary healthcare network that serves as the first point of contact, emphasizing prevention and health promotion, particularly for marginalized communities. Simultaneously, the COVID-19 pandemic underscored the non-negotiable need for health system resilience. Building robust infrastructure involves creating trained and adequately staffed workforces, ensuring reliable supply chains for medicines and vaccines, and establishing strong governance that can withstand shocks like pandemics and climate-related disasters while maintaining essential services. This resilience is crucial for protecting development gains from being wiped out by future crises. Critically, health outcomes are determined largely by factors outside the health sector. Therefore, successful implementation demands multi-sectoral collaboration. A whole-of-society approach engages stakeholders across government, e.g., agriculture, education, environment, the private sector, civil society, and local communities to address the social determinants of health, such as poverty, malnutrition, air pollution, and inadequate sanitation. This recognizes that health is truly everyone's business. The way forward hinges on sustained political commitment, evidence-based policies, and equitable investment. By prioritizing health, nations can create a virtuous cycle. Improved population health boosts economic productivity and reduces poverty, which in turn generates the resources for further investment in health and other SDGs. This integrated path ensures we build not only healthier populations but also more sustainable, just, and resilient societies for generations to come. This brings end to our presentation. As we move forward, we shall begin exploring Sustainable Development Goals 4, Quality Education, Global Progress and Challenges. We encourage you to stay connected with our channel for the upcoming session, and to share this content with fellow professionals who share their passion for sustainable development with our channel. Until then, I wish you all about their professional journey filled with excitement, challenges and sustainable prosperity.